My name is Melody Hoffman. I work for BRMC Medical Specialists, which is the oncology department. We have patients who come in who've obviously been diagnosed with cancer, some type of either blood disorders, things of that nature. So when they come into our office, of course, they're getting chemotherapy. They're, going through a lot of struggles during that time. So basically when they come into us, they're facing one of the hardest battles of their life. And so for me, it's so empowering to see them because some of them are so strong. I'm the first face that everyone sees. When you walk into BRMC Medical Specialists, I'm the first face you'll see. So they see me first, and then they go back, of course, into the doctors once they see me. But they have to check in with me first, and I get all their, their papers signed, their insurance cards, get them kind of warmed up to the clinic first. When you're faced with cancer, you go through hair loss. People are they're weak. Sometimes they come in and, they're just not feeling good that day because of, the chemotherapy that they're on makes them very sick. And so when they come in the door, I can tell if they're having a rough day, or, sometimes I have to get in wheelchairs because they're just not able to walk even to me because they're just so weak from what they're having to go through. And so, having to watch them go through that is, it's heartbreaking. But most of the times they're in the best spirits, and it's just amazing to see someone go through one of the hardest things. There's just so many challenges that oncology patients face that a lot of people don't realize, because until you're faced with it, you honestly don't see that everyday struggle they go through. Whenever patients first come through the door, I have to really look at them and see, okay, are they going to be able to walk to my desk? Or do they need to be admitted to the hospital, or do I need to get a doctor right now? So usually when they walk in, I have to be on the ball to figure out, what do they need right now? Or are they okay to, have a seat? Or, sometimes I usually go out to them in the waiting room because they just can't make it to my desk. And so, it's just every day you have to, with each individual patient, you just have to analyze, how are they doing? Are they okay? What do they need? Things like that. Anytime I hear that patients are in remission, it is just one of the most amazing feelings to hear that somebody has beat their cancer. And for me, you just can't get a better feeling than that.